And the first question would be, how do you stay calm during high stress emergencies? It's,
Oh,
yeah.
it's tricky. And I think often you're not as that there's a little trick to looking calmer on the outside than you feel on the inside, for maybe.
Hmm.
I think you need to have some confidence in your training. I think
Yeah.
allowing yourself to feel that this is hard. Like I think the people who go in and go, this is a piece of cake, I'm a little bit worried about them. I think acknowledging this is difficult, taking a breath.
Yeah. Yeah.
So just there's some simple techniques like box breathing, like just taking, calming down, having a few moments to yourself, doing a few box, in out long
Mhm.
breaths, it can calm you down. Being really structured, knowing who your team are, I think is really important as well. So I feel really confident. Even when I don't feel so confident in me, I know that I'm surrounded by people who are excellent. They're clever and
Mhm.
they're trained and they really care. And I think as well, I know that it doesn't serve the patient. Often it doesn't serve the patient for me to lose control, does it? So,
Mhm.
and look, there's a paradox here as well, which is so the more acutely unwell a patient is, this is a little trick, okay? The
Mhm.
more acutely unwell a patient is. So if I'm in a resus bay in emergency and someone is very unwell, so they're unstable, category one triage, actually the more unstable someone is, the more it all pulls back to basic physiology. So the
Yes.
person who's a category four with mild symptoms is much harder than someone who's category one unstable, because the moment someone gets unstable, there's clear protocols.
Yes.
So if all else fails and you don't know what to do, you just start at the start of the protocol. And I know that, like, so, people say to me, how can you manage a cardiac arrest? You must be so stressed in a cardiac arrest. And it's like, ironically, a cardiac arrest is almost the least stressed I am, because if I've got a cardiac arrest, I'm just
Mhm.
basically doing CPR, defibrillation,
Yes.
adrenaline on repeat.
Yes.
So actually, it all gets really
Yes.
easy during the cardiac arrest. And actually, a cardiac arrest gets harder when you get return of circulation, because then I have to start making decisions.
Yes.
So there's an irony to that, which is actually if someone's very sick, they're actually sometimes easier to manage. Also, if someone's very sick and unstable, and they're intubated and ventilated and on inotropes, on intravenous adrenaline, and I ring an intensive care specialist and say, can you take them to intensive care? They'll say, yeah, sure. And they'll come within a few minutes and take them away, because it's really obvious they need intensive care. But the
Yes.
person who's category four with mild abdominal pain, that could be anything from, constipation through to a perforated appendix, they
Exactly.
actually that's actually
Why?
diagnostically much harder and much harder to refer. So actually, ironically, the more sick someone gets, the easier emergency medicine gets.
Exactly.
And but you've got to have you've got to have your skills. Like I think you've got to make sure a basic set of resuscitation skills is absolutely necessary. So you need to know how to intubate. I think
Yes.
we need to, I know for me, I find comfort in rehearsing the hard bits as well. Like make sure you know how to use a defibrillator, you know how to intubate, you know how to put in lines. Like there's a basic procedural skill set that if you didn't have it up to date, you would feel bad. So you need to make sure you're constantly rehearsing as well.
Sure.